Hi, my name is Christian, and in this video I'm going to be demonstrating how to give a medication through a small volume nebulizer. Alright, so before we begin, we want to look at the patient's chart and why it's indicated that this patient needs it. So I want to make sure that I look at the physician's orders, and right now it says to give 3 mLs of ipratropium bromide and buterol, which is known as Duonet, to the patient. And most of the time he wouldn't have taken this through the a meter dose inhaler because he does not have a good inspiratory flow, so that's why they're asking to give it to a small volume nebulizer. We also want to make note that the small volume nebulizer will take some time, so I would make sure I look at that too on the chart, if how long the medication needs to be given. And then I want to look at the patient's chart. I want to look to see his vital signs, where they're at right now. Um, and I want to see if he's taking other medications, if he has other allergies. I want to make sure to see if he has any previous hospitalizations, blood work done, which like ABGs, chest X-rays, or any other pulmonary diseases listed. History of family history. See if he has any trends in the family illnesses, like as far as asthma goes. Does he have it? Does all the other family members have it? And I also want to make sure I have the correct patient. So I look at the name and then the time he was admitted into the hospital. I also want to make note too that another indication for small volume nebulizers for patients that just came into the emergency room and they need a breathing treatment, because they can't take, like I said earlier, they can't take an inhaler. They have to be on a small volume nebulizer. Okay, so before I go in, I want to check to make sure I have all my equipment. I got my stethoscope, I got a blood pressure cuff, I have the small volume nebulizer, which is important. I have a pulse ox, and my gloves and hand sanitizer. If there's any sanitizer inside the room. I want to note too of how what this looks like. So this is an Aero Eclipse small volume nebulizer, and it has 2 modes. One right here, the solid triangle means it gives out continuous nebulization, and in this, it's the dotted one means breath actuated. So what that happens is that you could see the green ball pop up every time. This is basically how this works, is that the aerosol, the drug is propelled on the patient's breath. So every time patient breathes in, the ball will go down, and then that means it's closing off. It's opening the drug and then closing off when it goes back up. So we're going to set it to continuous nebulization, because the patient, that means like if the patient doesn't have a good inspiratory effort, he can slowly breathe in and out through this, and I'll be explaining him how to do that. I just want to note in the video that that's how this works, and here we go. Also, I have my drug. I will be pretending that I will be putting the drug into the device, and I'll note what you will see when that happens. Okay? So now I'm gonna gather my things, and I'm gonna go inside.
Hello.
Hello, Mr. Lota. My name is Christian. I am a respiratory care student from Hartnell College, and may I please have your first and last name, please?
It's Richard Lota.
Okay. And date of birth?
January 3rd, 73.
Okay. All right. Let me see your wristband for me, please. Thank you very much. I'll make sure I have the correct patient. Okay, Mr. Lota, I'm here today to be giving you. Or is it okay if I call you Richard? All right. Thank you very much. Sorry, I got your last name wrong. So today I'm going to be giving you a breathing treatment today. I know you've been feeling some chest pain, and it's hard for you to breathe. Is that what I noticed? I read in the patient chart that you had really hard times of breathing and coughing anything up. So if you can, for me, before we begin doing some stuff, I just want to let you know that I'm going to have you cough into this napkin. I want to see if you can cough anything up. Okay? Okay, good. All right. So he hasn't coughed anything up yet. After the medication, we might see something, and that would be good. And I would make note of that too, how much he's coughed up before and after. Okay. All right, Richard. So what I'm here today is I'm going to be giving you a breathing treatment. It's going to help open up those airways, because right now they're constricted, and it's going to help open up. It's called Duonet, and it's a combination of a bronchodilator and a drug that maintains your breathing throughout the time of day. Okay. and we'll be giving this once. If you ever feel like you need it again, you can always call me back, and then we'll give you another treatment. Okay? Do you understand everything so far?
Yes.
Okay. I do want to make note some side effects you're gonna feel are like an increased heart rate and some jitteriness, and that means basically that the drug is working, but that's also a normal side effect. Okay? All right, so here we go. Then we're gonna do some vital signs, and I'm gonna do listen to your lungs before and after, and then I'm gonna do some blood pressure. Okay.
Okay.
All right. So are you sitting comfortable right there? Okay. May I see your finger, please? Anyone, that's fine. Thank you. And I'm just gonna rest this across your chest. Let me check your pulse. Okay, thank you very much. I'm just going to leave this on here for the time being, okay? Do this information. Saturations are 98. That's good. Doesn't need any oxygen to be administered. His pulse rate I counted was in 30 seconds times 2. I got 80. And then his respiratory rate was he breathed about 6 breaths. 6 times 4 is 20. Okay, now I'm going to be taking blood pressure. Just gonna wrap this around your arm, okay? Go ahead and breathe normally, okay? You did a great job. I'm just gonna rest this right here, okay?
Sure.
Yeah, she did. She picked me up like right as I walked out. Yeah. She lives in the city. The kids that drive. The kids drive over, up the step down.
Okay. 124 over 88 is what I got. Thank you, Richard. Put this back. Okay, now I'm going to be listening to some breath sounds, okay? I'm going to be listening to the back first, and I'm going to listen to the front, all right? Then I'm going to listen to the sides, and then I'm going to go up, okay? Bases off top. All right, so if I go ahead and kind of push it to the side. Thank you very much. Roll over, not push you. Okay. And again, in this, to listen to the lungs, you do a systematic approach. Start from one side, you go to the other, and then you go up like this. Kind of like a ladder. All right, so go ahead, take a deep breath from me. Thank you. All right, very good. Thank you. I'm going to roll over here to the side. I'm going to listen to the front, okay? very good. Now I'm just gonna listen to your neck, okay? So you take one more breath for me. Alright, sounds really good. I listen to his neck just to see if there's any indication of any signs of stridor, and I can differentiate whether or not the wheezing is coming from his upper trachea or his lower airways and the bases of his lung, okay? Alright, I'm just gonna button up your gown again. You always want to make sure you have the patient's consent to unbutton their gowns. If the patient was a woman, you want to let them know that if it's okay for them to do that, because most of the time they'll feel uncomfortable with us as men undressing them in the front. Okay. Thank you very much. Now I'm gonna be giving you medication right now. Okay, so I'm just gonna let you know that we're gonna be giving you again the Duoneb. I'm gonna put this inside here, and then what you're gonna do for me is you're gonna be wrapping your lips around this, and you're gonna inhale for me really slow and deep and normally. So like I said, if you feel like the drug is getting to your eyes, I want you to close them for me. Or if you can't do that, I'll keep them closed. I can put a towel over your eyes. Okay, all right. And then what you're gonna do is yeah, just wait a second. I'm just gonna pop this in. So I'd like to make a note that sometimes when we get our small volume nebulizers, they will be in a clear bag, and that's closed off in a clear bag, and that prevents any outside bacteria from coming into the nebulizer itself. So what we do is after we would give the patient his medication, we'll put it back in the bag, and then we'll put it behind him, just in case he needs another treatment. Most of the times these are found in the hospital in the bag, and they always have to be put away in the bag. Okay, so what I'll do is then I'll open this up, and I'll get my medication, and I'll pour it inside. I'll do an inside. I'll squeeze all of it in there. Then I'll close it up like that. I'll put this in. And the flow rate for this is 4 to 6 liters a minute. So then I'll shoot it up the flow. And then you'll see when it's working, you'll be seeing a mist coming off. And then once you see the mist, you can always check by putting against your scrubs or your hand, because they're blue. The mist will come out clear and white. If you see the mist, that means it's ready to be given. Okay, Richard? This is going to take about 10 minutes, all right? So I just will, or until the drug is all finished, just go ahead and wrap your lips around that. And then just breathe in slowly for me, slow and deep. Okay. And then Richard, if you can, after the 5th breath, I want you to take a nice deep breath in and then hold it for like about a couple seconds, and then breathe out through your nose, okay? You always want to make sure that the patient is sitting up normally and that the small volume nebulizer isn't tilted or anything. If it is tilted, that means the drug will be coming out. So while he's taking his medication, I would be charting on my chart to see if he's complying with the medication being given. So I'll be charting down notes. And it looks good. He doesn't look dyspneic. He is not having any using his accessory muscles, so he's tolerating the drug really well. Okay, so 10 minutes have gone by, and the medication has stopped in those 10 minutes. Okay, thank you very much, Richard. I'll take that. So again, I would be wrapping this up in the bag, wrapping this up, and then putting it back in a clear bag, the way he got it. All right, Richard. Now we're gonna be doing some vital signs again. All right, but before we do that, we're gonna be asking you, can you cough up anything again one more time? Good, very good, very good. I will make note of if anything came out or if nothing came out. Right now, nothing came. A couple things came out, and actually, that's pretty good. That means the drug is working. Most of the time, if it's still clear, then that's still okay. But if he is having trouble breathing, that means the medication we'll have to give him another dose in a much later time. Everything looks good from here. His cough is productive, and that's great. I always have a cup to keep any sputum that came out, and I'll put that in the cup. All right, let me just go ahead and take your pulse. Go ahead and rest your hand there. Thank you very much. Okay, thank you very much, Richard. And we're gonna be taking this off now, okay? You probably didn't like that little guy, huh? It's just doing its job. It's just measuring the oxygen in your blood. People always freak out on these things. It doesn't do any harm. His saturations were 98%, so that's pretty good. He also, his pulse went down a little bit, so it was like 76, so that's a lot better. And his respiratory rate went from 20 to 12. All right, and now we're gonna be listening to, actually, let me listen to your breath sounds real quick. After that, I'm gonna take your blood pressure one more time, okay? So I'm gonna be listening to the back. I'm gonna just turn it to the side. Go ahead, take. Okay. All right, good. I'm not hearing any wheezing anymore. That's pretty good. It means the drug has been working and it's taking effect. Now I'm gonna do your gown in the front again. Doing a great job so far. All right, go ahead, take a deep breath here. Now I'm gonna listen to your neck, okay? All right, good. That's good. I don't hear any wheezing on there, on those airways. I'm just gonna button up your gown.
Care plan? I think I'm gonna go home and do my stuff. Nobody's here.
Hey, Richard. I'm gonna be doing your blood pressure, okay? Okay, go ahead and put some right there. All right, how's that feel? Pretty tight?
Feels okay.
Okay.
What? I'm sorry?
I know it feels a little tight.
Did you do
It's pretty good. 124 over 82. Pretty normal. Does that sound pretty normal for you? All right, awesome. All right, Richard. All right. If there's anything you need, anything else before I head out?
No?
No,
Okay.
so pretty good. Okay, so if you feel that chest tightness again, there's a call button here. You can call the nurse to ask for me. Again, my name is Christian, and I'm glad I can help you out today. Okay.
I appreciate it.
All right. Thank you very much, Richard. So I'll dispose of my lungs. I'll dispose of my gloves in the room. To the side trash can. If there's a sink, I will wash my hands. If there isn't a sink, I will hand sanitize. And then I'll take my stuff out of the room. I'll desanitize my items, my stethoscope, my pulse ox, anything that may contact with the patient. I would sanitize that, and I'll clean all that. And then I'll chart down everything that I did today, that I saw from the patient, his breathing, their vital signs, the sounds of their wheezing, or if they're diminished now, before or after the treatment. And that's pretty much it. Thank you very much, and have a good one.